Experience in giving back. We give them all honor and worship belong to Him. He alone is worthy of our praise. I bring you all greetings from London, Mr. Babadide Olushola, Mr. Tokamu, Mr. Transformer, Mr. Blue Light, Red Light, Green Light, Sowo Omode, Sowo Obìnrin, Sowo Àgbàlagbà.
Patient since 1,531, and of these leaders were given 57% of these were given leaders. That's leaders. Enter unit. Enter unit, we had a full-fledged enter unit, and we had state and polishing law, we had good extraction, we had treatment, enter treatment, and that was all.
Chief Rasaq Okoya celebrates 86 with medical outreach for over 5,000 Lagos residents. Unlike many of his contemporaries who turned their backs on the poor in times of need, Chief Dr. Rasaq Akoni Okoya, CON, has consistently offered a shoulder for the less privileged to lean on. This defining trait was on full display for 7 remarkable days beginning from the penultimate Monday, when the billionaire industrialist chose an uncommon path to mark his 86th birthday. Instead of hosting affluent business associates, socialites, political leaders and public office holders, Okoya welcomed the battered, the neglected and the abandoned as special guests of honor. Rather than throwing open the doors of his palatial residence for a lavish celebration of wining and dining, the revered octogenarian transformed his birthday into an impactful humanitarian intervention, a comprehensive medical outreach that provided free healthcare services to those who could not afford the rising cost of medical care. In choosing compassion over celebration, Chief Okoya once again demonstrated a life defined by gratitude, grace and generosity, values that have become synonymous with the renowned philanthropist. Born on January 12, 1940, in Lagos, to a tailor, Tiamiyu Ayinde Okoya, and Alhaja Idiato Okoya, his early years were shaped by modest beginnings. He learned the value of diligence while assisting in his father's tailoring business, mending clothes and selling accessories. By the age of 17, he had saved £20 from these humble efforts, complemented by his mother's £50, which he used to venture into importing lace, watches and household items from Japan, filling a critical gap in Nigeria's emerging consumer market. That bold step marked his transition from apprentice to entrepreneur. Guided by his enduring mantra of consistency, perseverance, hard work, commitment, passion and integrity, Okoya steadily built an industrial empire without cutting corners. His philanthropy took on a new dimension on Monday, January 5, 2026, when the chairman of Eleganza Industrial City Limited officially flagged off the week-long Okoya at 86 medical outreach at his sprawling Oluwanishola estate along the Lekki-Ajah Expressway, Lagos. For many of the beneficiaries, individuals who ordinarily would never have gained access to him, the outreach provided unhindered entry. His reasoning was simple yet profound: good health is the foundation of a good life. Aware of the harsh reality that millions of Nigerians lack access to quality healthcare, Okoya designed the outreach to bridge that gap by delivering free, comprehensive medical services to people constrained by poverty, limited education and inadequate information. The response was overwhelming. Residents from nearby and distant communities trooped out in large numbers. Men, women, young parents and the elderly were received with dignity, seated comfortably on classic Eleganza chairs inside the over 300-capacity hall of the expansive estate, as qualified medical professionals attended to them with care and compassion. In all, over 1,000 residents from Ajah, Jakonde, Ikota, Iru, Egunshi, Eleko, Epe and surrounding communities benefited from the initiative. Fondly called Eleganza by generations of Nigerians, Okoya's legacy stretches far beyond boardrooms and factory floors, from the iconic Eleganza barrel that supported pupils, students, traders, artisans and professionals nationwide, to decades of industrial innovation and nation building. At 36, he chose to write a new chapter not with ink, but with empathy, reinforcing his belief that health is the cornerstone of prosperity, even as poverty, illiteracy and information gaps continue to deny many access to basic health care. Far from being a symbolic gesture, the outreach has been widely described as unprecedented, with beneficiaries expressing deep gratitude for gaining access to ordinarily expensive medical services at no cost. The program offered free prostate cancer, HIV and tuberculosis screenings, dental and eye care services, breast and cervical cancer detection, family planning, laboratory tests and medications. Beneficiaries also received food packs and a 10,000 naira transport stipend, as disclosed by the consultant to the Okoya at 86 Medical Outreach and retired permanent secretary of the Lagos State Health Services Commission, Dr. Jemila Delonge. Addressing the beneficiaries, Chief Okoya shared a deeply personal testimony, revealing that he was diagnosed with prostate cancer 6 years ago, a condition he survived due to early detection and timely medical intervention. While acknowledging that he has been privileged to enjoy quality health care throughout his life, he lamented that many Nigerians are not so fortunate. He said, "Years ago, I was diagnosed with prostate cancer. Because it was detected early, I underwent surgery and I am healthy today. This birthday is not about me, it is about giving people the opportunity to live healthier and happier lives. Health is wealth. I prayed to God to see this urge. When health challenges are detected early, they can be managed. That is why I am grateful, and why I decided to extend the healthcare I have enjoyed to my community, so that everyone can know their health status. That is the purpose of this medical outreach."